Welcome back. Last week, Joe Ross, president of Meritus Medical Center, while talking to the Washington County Commission on Aging, suggested that the healthcare industry is partially responsible for the opioid crisis in Washington County. Ron, how do you think opioid addiction can stem from healthcare, and is it fair for them to share in the blame?
Yes, it's fair for them to share in the blame, but maybe I think drug companies is the ones that needs to really share in the blame. I think there could be different types of medicine that's built, designed, how do you do it, researched, that didn't create the problem of addiction that we have now. I don't think we put enough effort into medicine that is not addictive as what is being prescribed. Is the hospital part of the problem? Every drugstore is part of the problem. Every doctor is part of the problem. Every one that disperses medicine is part of the problem. How do you deal with it? I mean, it's a very difficult thing. We have a lot of illnesses that are treated, and in that treatment process, people become addicted. I see people going to the store or going to the up to the counter at, because I picked my mom's medicine up at Walgreens, and hear people going up in the stories that they use to try to get opioids. It's unbelievable, just to get a fix like.
Yeah. Henry?
Well, you know, unfortunately, I have a family member who has chronic pain, and they use an opioid medication. I also have worked with people who've been in that situation. I have another family member who's on the other side of the table and prescribes it. And it's a tough situation because you have the people who are in chronic pain, or whether it's a short-term or long-term, they're being prescribed medications to deal with that. You know, I had knee surgery a few years ago. The doctor prescribed me 30 pills. Well, I only need to use 2 of them, and then because I didn't like the way I felt on them. What happens with those other 28 pills? Okay, you don't want to leave them sit around. The way some people get addicted to it is they raid someone's medicine cabinet. Mm-hmm. So they get access to it, and it's not through the doctors. It's through another funny means. Children have access to it because children just sort of have a run of the house, and it's not that the kids are bad. Kids are kids. They experiment with things, and it's a terrible tragedy that we have this type of medication that they can actually gain access to. So, you know, parents need to be responsible in how they do it. But when you have someone, and the people who are on the pain medications, they go through, you know, at least in the practice that I'm exposed to, they go through a regular drug screen. And if there's something wrong with that drug panel and they have other drugs in the system, they'll discharge that patient. Well, now we create a situation this patient's going to seek other means. We need to capture that point and figure a way that we can transition those people off of pain medication. If the doctor feels they no longer need it, or if they violated the terms of the agreement with that practice, they need to find some way to manage that patient, not within the practice, but some kind of catch-all to prevent them from trying to source it from the streets. At least that's my opinion of it. We need to, and I know we stigmatize and say, well, you know, drug abuse, and we need to source out drug treatment. We need to find a way that we can work people off of these drugs. We need to stop doing the Narcan challenge where people try to take as many drugs before they are beyond their limit, and then get a Narcan injection to save their life. So it's a lot of moving pieces. I know we have some local politicians who are involved. I know the governor's involved with this. President Trump has mentioned it. It's just, there's a lot of moving pieces. There's no one answer, but I think we, you know, with what was said, I don't think it needs to come straight from the hospital, but I think the practices need to be able to function. And I think at least the practice I know of that a family member works at, they are very responsible in how they try to handle it.
So Ron, what about the time release versions of these opioids? Are they supposed to be better in terms of
My understanding
addiction?
is that there is a time release factor to them as when they really kick in. And that's what I'm saying. As we go forward, can't we have some through our research and development, some type of research that comes out with something that isn't addictive?
But there's a plethora of medicines out there that are supposed to be better than the one before. And then,
Can you take penicillin?
yeah.
Can you? There's some people can't take penicillin, so there's an alternative.
But we're dealing with a different type of issue. We're dealing with a chronic pain issue. And, you know, for a family member I know who is on the medication, they tried to transition this individual from a fentanyl regimen to Suboxone. Oh, what's better? The withdrawal symptoms they displayed were awful. Tremors, sweats. I would never want to see someone go through that.
So they must have been on the original medicine a long time.
Well, your system builds up a tolerance, and you have to be completely empty of one to another. What's really scary is they're taking these medicines and they're cutting it with heroin. And fentanyl is 10 times more powerful than heroin. We're talking micrograms when you talk about a dose of fentanyl. So it's getting cut with heroin. That's causing a lot of the overdoses. It's a quick high. And then we said about how readily available it's become. The drug war failed.
But are we not prescribing as a nation, well, let me rephrase that. We are prescribing as a nation far more prescriptions than we did in the past. In 1991, for example, there were reported to be 76 million prescriptions written. In 2011, 219 million.
And percentage of population, that's also a higher percentage of population, because people are, you know, years ago, if I hurt my back doing something, I probably wouldn't run to the doctor and ask for a pain pill. I pop an aspirin, keep going. I still do that. I think some people don't. I think it becomes too, oh, well, this really helped me out last time, so let's go do it this. I think it's become too readily accessible, and it's easier to write the prescription than to say no some days.
Look at the amount of drug advertisements on the TV.
Oh, it's incredible. Yeah.
And a given evening, every time.
Of that minute advertisement, this much tells you what it'll do, and this much tells you what the potential downsides are. I always find that very interesting.
You wonder
and you're going to get the last word on that, Ron. Up next, we are talking about this week's winners and losers. We're back in 3 minutes. We hope you will join us.